Hello everyone. Is my audible? Is my voice audible and my slides visible? Is my voice audible? Hello everyone. Hello everyone. I am Dr. Ravi Teja. I am infectious diseases physician from Hyderabad. Today I will tell you about important topic of adult vaccination. So why adult vaccination is important? What are all the vaccines available which adults can take, and what is the importance? So prevention versus treatment. So as you know, prevention is always better than treatment. So there are no conflicts of interest. No AI was used to prepare this presentation. So these are two scientists named Kathleen Carrico and Drew Wiseman. These are foreign scientists who are awarded Nobel Prize in Physiology or Medicine in 2023 for their discoveries concerning nucleoside-based modifications that enabled the development of effective mRNA vaccines against COVID-19. All of you saw how COVID-19 pandemic caused loss for many millions of lives. So these two scientists were very key in developing this mRNA technology, which helped everyone to produce COVID-19 vaccines, which have saved millions of lives. So these two scientists, for their key work, have been awarded Nobel Prize in Medicine or Physiology in 2023. And this another scientist named Max Thiele, who was awarded Nobel Prize in Physiology and Medicine in 1951. He is based from USA and he was awarded Nobel Prize for his discoveries concerning yellow fever and how to combat it. So with the help of his key discoveries, we could develop yellow fever vaccine, which has saved millions of lives throughout the world, especially in African countries. So why adult vaccination is important? Why we are discussing this today? Because by the end of 2030, around 23% of our Indian population will be more than 50 years of age. So this is the statistics. So in coming 5 years only, one-fourth of our population will be above 50 years of age. And this vaccination will prevent severe disease and complications and its associated morbidity and mortality in this elderly population. And there are certain vaccines which can prevent cancer too, like HPV vaccine and hepatitis B vaccine. As you know, HPV vaccine prevents HPV associated cancers in both men and women. And hepatitis B vaccine can prevent chronic hepatitis B related hepatocellular carcinoma. So, as you know, there are some diseases which are eradicated from the world just because of vaccination. So, what are they? There are many diseases, like one is smallpox, and there are many diseases which are close to eradication because of vaccination, namely polio, measles, mumps, rubella, diphtheria, neonatal tetanus, and Haemophilus influenzae. So, all these diseases because of vaccination, especially childhood vaccination, are close to eradication throughout the world. So, who recommends these adult vaccines and adult vaccination? So, worldwide, many organizations, especially World Health Organization and Center for Disease Control and Prevention, the CDC, the US organization, and our Indian consensus guideline also recently published about adult vaccination. So this recent guideline, Indian Consensus Guideline on Adult Immunization, was a combined guideline by various specialist associations throughout India, like cardiology, infectious diseases, OBG, pulmonary medicine, nephrology, critical care, oncology, rheumatology. So all these advanced specialties have come together and recommended all these vaccines. So I will just review few cases which could have been prevented by simple vaccination. Because of they have not taken vaccine, they have developed severe disease. The first case is the 70-year-old gentleman from Hyderabad. He's having diabetes and hypertension. He came with fever, cough, and breathlessness for 5 days. And his fever was high grade fever, which was documented 101 fever. And he also had cough with expectoration and also breathlessness, which is of MMRC grade 4. He was severely breathless, so he came to the emergency with these symptoms of fever, cough, and breathlessness for 5 days. There was no travel and there's no sick contact. So he came to emergency. He was hypoxic on arrival itself. So his saturation was 88% on room air. His blood pressure was normal, but he was tachypneic with respiratory rate of 30 per minute. And on lung examination, he had bilateral basal bronchial breath sounds and their occasional craps too. And other systemic examination was normal. So, suspecting this patient with history of acute febrile cough, breathlessness, hypoxia, and a diabetic patient, we our provisional diagnosis was community acquired pneumonia. Because he was hypoxic, it was moderate to severe CAP. It can be either bacterial or viral etiology, or it can be any other community acquired sepsis like any scrub typhus or urosepsis. So, thinking of community acquired pneumonia with hypoxia, we went ahead and did CT chest in the emergency. We showed the following video. So, as you can see, there is consolidation in the left lower lobe, very bad consolidation with air bronchogram, air bronchogram, air bronchogram, air bronchogram. So, suggestive of severe pneumonia. So on evaluation, we found pneumonia, the etiology is Streptococcus pneumoniae, which was identified on PCR. So this is the final diagnosis is moderate left lower lobe community acquired pneumonia caused by Streptococcus pneumoniae in a diabetic patient. So can you tell, is there a vaccine to prevent this severe bacterial pneumonia? So by taking this vaccine, can this be prevented? Yes. So there is a vaccine for this streptococcus pneumonia, that is pneumococcal vaccination, which is approved in all adults above 50 years of age. So once in a lifetime, if this adult, if you had taken the pneumococcal vaccine, the severe disease would not have occurred. So is one of the example, the common example, community acquired pneumonia. The most common cause is streptococcus pneumoniae in elderly patient with comorbids. This could have been severe disease, could have been prevented by simple pneumococcal vaccination. The second patient, this is a 58-year-old woman, resident of Hyderabad. She is newly detected with uncontrolled diabetes, and she was admitted with ICU with diagnosis of urinary tract infection, that is pyelonephritis, with acute kidney injury, and she was requiring hemodialysis support for her acute kidney injury. And few days into hospitalization, the patient developed this erythematous rash involving the trunk on the right side. So can you guess what is this? So this is okay, you have to describe the rash. So this is a looks like a vesicular rash involving the right side of the trunk around T6 dermatome. So looks like a dermatomal rash. So if you see only involving the one dermatome, no other dermatome is involved, and it is a linear shape. So this is dermatomal distribution of vesicular rash size 2 of shingles infection. So, is there a vaccine available to prevent the severe, excruciating, painful shingles? As you know, shingles is due to reactivation of varicella virus in adults. So, it's a very painful disease. So, is there a vaccine available to prevent this simple shingles? Yes, shingles vaccine is available, which is approved in all adults above 50 years of age. So, two doses in a lifetime, 2 months apart. If they take this vaccine, can prevent severe shingles. Next case, next patient. This 15-year-old gentleman from Hyderabad. He is non-diabetic and is a person with HIV on ART. He is well controlled. Came with altered sensorium and right side weakness. So, in view of suspicion of cerebrovascular attack, so MRA was done, which showed left MCI infarct and is a diagnosis of acute meningoencephalitis with right hemiplegia. So, he also had altered sensorium. Pure CVA should not have altered sensorium, but he is because he's having altered sensorium, so acute meningoencephalitis was suspected with right hemiplegia. So this is the image of the patient. As you see, the left side of the face in the V1 dermatome, there is healed rash. So what is this? So this is this patient retrospectively had HIV patient retrospectively had recent shingles on the forehead, which led to varicella zoster meningitis. So the zoster involving the face has spread retrospectively into the meninges and caused varicella zoster virus meningoencephalitis. So is there a vaccine available to prevent the disease? Yes, this HIV patient, well controlled, you could have prevented this severe disease by taking simple shingles vaccination. So that is a very this patient developed stroke after shingles. So you could have taken this vaccine and prevented this life-threatening stroke in him. Next patient, the 64-year-old gentleman from Hyderabad is non-diabetic, non-hypertensive. He is newly detected person with HIV, and he presented with complaints of fever, abdominal pain, generalized rash all over the body. So this is the rash in this patient. So as you can see, there are multiple rash, vesicular rash all over the body, in the trunk, in the neck, in the arms. The close-up image is this. So can you tell what is this? So as you describe this rash, so this is a vesicular rash, a generalized vesicular rash, and the vesicles are also at various stages of development. Like if you see one, this vesicle is crusted, this is crusted, and this is active, this is crusted, and this is large, and this is small. So this is very typical of chickenpox, that is varicella. Lesions, vesicular lesions of various sizes and at various stages of development. Is a classical description of varicella rash. So, is there a vaccine available to prevent this severe disease? Yes, varicella vaccine. If this patient would have diagnosed HIV earlier and is well controlled, absolutely, you could have given the varicella vaccine also if he's not immune. So this patient had very severe disease involving the lungs, liver, pancreas, like pneumonitis, hepatitis, pancreatitis, and require ICU support, and also 10 days of hospitalization. All these could have been prevented by taking simple vaccine. Not only HIV patient, in all clinical practice, you see all adults who have not developed chickenpox in childhood are prone to develop chickenpox in adult. So those adults can check their varicella immune status by checking varicella IgG. If they are negative, they can take the vaccine and prevent chickenpox. Next patient. This is 23-year-old gentleman, IT employee from Hyderabad. There are no comorbids. He came with chief complaints of fever for past 5 days, and he complained of rash over face and chest for last 2 days, and associated cough, running nose, and congestion of both eyes. So fever was there. After fever, he developed a rash over face and chest for 2 days, and associated cough, running nose, and congestion of both eyes was present. So only he had attended a temple gathering 10 days prior illness. So this is the rash. As you can see, erythematous rash, maculopapular rash involving, this is not vesicular as compared to previous patient. This is maculopapular rash, not vesicular rash. Erythematous rash involving the neck, trunk, and arms. Even on the back, in the neck, arms, as you can see, generalized erythematous rash involving all the arms, face, trunk also. So on evaluation, he was diagnosed with adult measles. His measles IgM was positive and IgG was negative. So it is a case of adult measles. Retrospectively, he has not taken his childhood measles vaccination. So of 10 months of age, he did not receive his measles vaccine. So this is increasingly seen. Some children, below poverty line children, or who are not aware of vaccination, who miss the vaccination, can develop measles, and measles is a very contagious disease, can spread to adults who do not have immunity. Okay, so this severe disease could have been prevented by taking simple MMR vaccination in adults if he has checked. So in adults, normal adults, 1 or 2 doses 4 weeks apart, if no prior immunity is documented, and if is a healthcare professional, 2 doses 4 weeks apart is recommended. Next, coming to liver cancer, as I've told before, chronic hepatitis B virus infection is a major cause of hepatocellular carcinoma, that is primarily liver cancer caused by chronic hepatitis B virus infection. This can be prevented by taking simple hepatitis B vaccine, which can greatly reduce the incidence of chronic hepatitis B related hepatocellular carcinoma. And hepatitis B vaccine schedule is 0, 1, and 6 months. So 3-dose vaccine which will complete the vaccination. So just before giving this vaccine, we have to check whether the patient is having active hepatitis B or not, or doesn't have any immunity to hepatitis B. So these two tests have to be done before administering this vaccine. Next is human papilloma virus related cancers, which can be prevented by simple HPV vaccine. The human papilloma virus vaccine protects against high risk HPV types that can cause HPV related cancer in both men and women. There's a perception that only women needs to take this vaccine, and it only protect gynecological cancers, but it also protects penile cancers, oral cancers in men. So both men and women, boys and girls are eligible to take this vaccine. So what all cancers it will protect against include cervical cancer, anal cancer, vulvar cancer, vaginal cancer, penile cancer, oropharyngeal cancer involving the throat, tonsils, and back of tongue. So HPV vaccine is one of the strongest cancer prevention tools available to the mankind, which can prevent all these many types of cancers in both men and women. And this human papillomavirus vaccination can be taken by both girls and boys. So all persons, it is recommended until 26 years of age. So depending on the age, it is either a 2-dose vaccine or a 3-dose vaccine. It is a 9-valent vaccine. If age is between 9 to 14 years, it can be started as early as 9 years of age till 26 years of age. If the age is 9 to 14 years, a 2-dose series is given at 0 and 6 months. If age is 15 years or older, a 3-dose series at 0, 2, and 6 is given. And coming to vaccines in pregnancy, So a 23-year-old primary gravida first pregnancy comes to for routine second trimester antenatal health checkup. So does she need any vaccines? Are vaccines safe in pregnancy? Yes. So there are a number of vaccines which pregnant women or pre-pregnancy also they can take. The most important things are Tdap vaccine, that is tetanus, diphtheria, and pertussis vaccine. This can be taken one in each pregnancy. Each time pregnancy occurs, during the pregnancy, this Tdap vaccine can be taken. And influenza vaccine at third trimester. This above two vaccines best if taken in third trimester because the immunity will be at the peak and it also helps in passing the antibodies to the newborn. So these two vaccines are recommended in pregnancy. Tdap and influenza vaccine best in the third trimester of pregnancy. Apart from these two vaccines, hepatitis B vaccine can also be taken. It's a non-live vaccine. So if the mother is HBsAg negative and doesn't have immunity, that is anti-HBs antibody titers are negative, she is qualified to take hepatitis B vaccine. That is 3-dose vaccine, 0, 1 month, and 6 months. And pre-pregnancy also, most of the times I get patients who are pregnant and who doesn't know in childhood whether they have developed chicken pox, and they get feared when any person in their family or neighborhood develops chicken pox, that they will get chicken pox, whether their baby will be affected with chicken pox. So to avoid all these scenarios, so better pre-pregnancy they have to check their chickenpox protective immunity levels by checking simple IgG levels. If they are negative, pre-pregnancy only they can take the vaccination and get the immunity so that in pregnancy they are off all these stresses. So if they're unsure about chickenpox in childhood, as a chickenpox is a live vaccine, they can't be given. It cannot be given in pregnancy. So pre-pregnancy only they have to check their immunity levels and complete the 2-dose vaccinations 4 weeks before conception. Similarly, rubella also. Rubella also is a deadly disease. If acquired in pregnancy, can lead to many birth defects. So, pre-pregnancy only, rubella immunity levels are checked by checking IgG levels. If they are not immune or titers are low, they are advised rubella vaccination 4 weeks before conception. And in as all live vaccines are contraindicated in pregnancy. So this MMR and chickenpox are not given in pregnancy. They have to be completed 4 weeks. The 2 dose should be completed 4 weeks before the conception. So this is the schedule recommended by the CDC, Center for Disease Control and Prevention of the USA. So they gave two schedules. One is age based, second is comorbids based. First, I will explain the age based schedule. So as you can see here, 19 to 26, 27 to 49, 50 to 64, and more than 65. So as you can see, this yellow indicates it is compulsorily recommended. So just remember compulsorily recommended vaccines. That is the most important vaccines. So if you take 19 to 26 years of age, so what are the yellow bars? You may see like that. So first one is influenza. So influenza is compulsory recommended. This is also influenza. Next yellow is Tdap. So 19 to 26 years, if you have not taken, take 1 dose of Tdap. And if you are not immune, take MMR 19 to 26 years. And if you are not immune, you have not got chickenpox in childhood, take the varicella chickenpox vaccine. And 19 to 26 years, you have to take the HPV vaccine, as I have told you before. And also hepatitis B. If you are not immune, you have to take the hepatitis B. Similarly, 27 to 49, same influenza, Tdap, MMR, varicella, HPV alone till it is 27 years of age. So 27 years of age only HPV is advised, and this light blue is depends on the patient and the clinician. If the patient requests, the clinician can give till 45 years of age. Next, hepatitis B. So these are the compulsory recommended vaccines at 27 to 49 years of age. Next, above 50 years of age. Above 50 years of age, the yellow ones are influenza, tetanus, Tdap vaccine, MMR vaccine, and zoster. So above 50 years, the shingles vaccine, not the chickenpox vaccine. Shingles vaccine is advised. That is 2-dose vaccine above 50 years. The next one is pneumococcal vaccine. So above 50 years, the most, and also hepatitis B vaccine. So above 50 years, the four most important vaccines are influenza vaccine, pneumococcal vaccine, shingles vaccine, hepatitis B vaccine. Just remember like this, these four vaccines have to be given. And above 65 years of age, all are same except the hepatitis B vaccine, which depends on the patient and clinician status. And the second schedule is according to the comorbids like pregnancy, immunocompromised state, or patients with HIV, or men who have sex with men, or asplenia, complement deficiency, heart or lung disease, kidney disease, chronic liver disease, diabetes, or healthcare personnel. Based on comorbids, so these are the all vaccines. The most common thing in our country is diabetes. So we will see diabetes. So in diabetes, what are the yellow bars? First one is influenza. So influenza is recommended. Next is Tdap. Tdap is recommended. MMR if he is not immune, varicella if he is not immune, pneumococcal, and hepatitis B vaccine. So these three vaccines like influenza, pneumococcal, shingles, and hepatitis B in diabetes. So based on the comorbids, vaccination also is there. And in pregnancy, as you can see, I have discussed two vaccines, influenza vaccine, Tdap vaccine. So in pregnancy, yellow bar is influenza, second is hepatitis B vaccine, and Tdap. Tdap, one dose in each pregnancy, as we have discussed, one dose in each pregnancy. Okay. This RSV vaccine is not yet available in India, is yet to come. So simple take-home messages are you or your parents or relatives or patients above 50 years of age? What are the most important vaccines that you should recommend to your patients or relatives or family members? What are there? So first one is the flu vaccine. Flu vaccine is an annual vaccine. So every year before start of the rains, it is August, the WHO will release that year flu vaccine strain. So all have to take annual flu vaccine. Second one is pneumococcal vaccine. Above 50 years of age, the pneumococcal vaccine, the new vaccine, which is once in a lifetime, they can take the pneumococcal vaccine. Third, shingles vaccine. Two doses in a lifetime, 2 months apart. So we have to take the shingles vaccine. Above 50 years of age, influenza, pneumococcal, shingles. Simple. Next, if 9 to 26 years of age, the human papillomavirus vaccine. From 26 to 45 years of age, based on the clinician and the patient. If the patient request, you can also give HPV vaccination and hepatitis B vaccination also, which is very important, which will prevent chronic hepatitis B infection and can also prevent chronic hepatocellular carcinoma due to chronic hepatitis B infection. So these are the take-home points everyone should remember. And thank you. Yeah. So all of you, please remember